my name is Sukriti Casey and I work as a practice manager and treatment coordinator at Pure Periodontics. Dental anxiety has many causes. So sometimes it can just be a very bad previous experience. Sometimes it can just be the fear of unknown. Most of the time when coming to a specialist practice ourselves, it is the traditional idea of gum disease treatment involving a lot of invasive treatment and then the gruesome work. So they are not too keen on having that done. Therefore, they tend to delay the treatment, which tends to further elevate their anxiety levels. So there are various causes to it. Most of our patients that I see here, like I said, is just a fear of the unknown. And what I tend to do is, during treatment coordination, I spend that dedicated time with them to identify what the reasons might be. Sometimes it's obvious, sometimes even the patient, it's a journey for both of us to try and figure what it is. And then I can advise them accordingly. Let's say if a patient is anxious of the anesthetic, then I tend to not even use the word anesthetic and just use a synonym and just say a numbing gel would be used, and then we need to numb them up. So something as simple as that can make a big difference to our patients. For others, it might just be the sound of the whole process that they're not fond of. For them, I tend to suggest to just bring their Walkman or their iPod with them to listen to their own music, and they tend to also see that it really helps. It's these things that we don't tend to think about obviously, but then once we put in practice, we see that it has really good outcomes. Similarly with breathing techniques as well, patients who are really anxious tend to hold their breath. So just advising them to breathe regularly, to pace the breathing also helps to calm them down. So there are loads of ways which we can help our patients. And for more severe level of anxiety where they feel they absolutely need some sort of help, then sedation options are always there. And I can help them, talk them through the process, inform them on the options available, and also make arrangements for this. It is very important for us to ensure that our patients not only understand their treatment options, but also feel engaged in making the treatment decision. Often it can be as simple as engaging in a friendly chat and providing much needed reassurance to help our patients feel relaxed, or it can be exploring the psychological underpinnings of the cause and nature of dental anxiety in patients and advising them on coping strategies. Either way, communication is key when treating nervous patients, and I make sure to spend that time with them to encourage them to communicate their needs. I also relay this information back to the treating clinician and relevant team members, so the whole team is aware when treating a nervous patient, so that we can provide that extra support and care that they need.